Hi, as promised, we're back here with Eric, and it's been 1 month now, almost to the day, 1 month since we completed Eric's treatment. And Eric, if you could just tell us what your experiences have been over the last month. What have you found changing? And by the way, one thing I should know too, as I get in here, we have not done any other treatment other than was it the last video we did Eric's equilibration a little over a month ago. He came in for a reevaluation, and we really had no adjustments to make. So we've done absolutely no treatment on Eric since that day about a month ago. So Eric, again, tell us what's happened since then.
Since then, my jaw feels fine. My jaw has moved forward, obviously, like what was supposed to happen, and there's no problems there, which I'm excited about. Actually, I can close my mouth and everything touches fine, which is important, obviously. Then we were talking a little bit before that. I have no migraines anymore.
Okay, so yeah, tell me, before this we kind of talked a little bit, and Eric shared some things I thought might be kind of interesting. Go ahead, Eric. Tell about the migraines and the neck and all that.
Since I've been starting with migraines, I could never wear a tie to work anymore because just the pressure around the neck and that would just even give me a migraine. So now I can wear a tie, and that's
okay.
Amazing, definitely. And what else has been going on? I haven't been chattering at night anymore. And the biggest thing is my sleep pattern has changed. And I'm not sleeping 10, 12 hours a day anymore. I'm sleeping about 8 hours a day. I got back to exercising. I'm like getting back to normal. I'm more energetic. I don't have the dark circles underneath my eyes anymore. I still have to take another college class. So, my life has totally improved.
Yeah, it's cases like this. It's cases like this that really fuel the passion for myself as a clinician. Eric came into us really complaining of, a little bit of wear and tear on the front teeth and some relatively minor aesthetic issues, and a sense that the bite felt off a little bit. But as we got in and really evaluated, we uncovered a whole lot more. And I think when we look at Eric as any patient, I look at them, what I call the critical triad. And that is, we look at you from a standpoint of function, from a standpoint of aesthetics, and a standpoint of comfort. And comfort not just in your teeth, in the sense that your teeth aren't hurting or aching, but comfort in your entire masticatory system, your entire jaw complex, and your whole cervical and whole head and neck region.
Right.
And it's so exciting to see patients like Eric who suffered severely from migraine headaches, to see that how have they done? How many of you had since we completed?
None.
And what was a typical pattern that you had before we began treatment?
Pattern for me, I would go for a month with the migraine straight, miss a whole month's worth of work, and then I would get out of that cycle, and it may be 2 or 3 days or even a week long, and I would be on the Oxy and the Imitrex and all this other medication, and it would just escalate from that. And once I came down from that, the medicine being body would start all over again.
It's things like this of, when we look at ourselves as clinicians, it's so exciting. It's so exciting to say that, our ultimate goal, I think, for all of us as clinicians, is to, in some way or in as many ways as possible, to improve the quality of life of our patients. And, cases like this, and this is, I can't go in with every patient and guarantee that I'm going to solve every cervical and every head pain problem, but we had some, from the beginnings of our treatment on Eric, or from the beginnings of our evaluation, we were fairly confident that we'd be able to give some help. And so it's important to realize that even though Eric came in primarily for his front teeth and just to get some things even out a little bit, they obviously had some very dramatic impacts. Understanding migraines are really a problem of the trigeminal nerve circulatory system, or the nervous system associated with the trigeminal nerve. And anything we do treatment-wise that impacts upon the trigeminal sensory input can have very potent triggering effects on migraine headaches. And although I would not suggest that every patient in the world who has migraine headaches is going to benefit from or be cured of migraine headaches, we find many, many patients do. And so even though we're here today really talking primarily concerning this video with the functional and the aesthetic issues, I just had to take a few moments here to just emphasize how important this is also as part of the treatment. So as we get ready to conclude here, a couple of things. Going back, if you remember, to the very beginning in the introduction, I described what were the goals of this video. And initially we talking about condylar position. And one thing I'd like to talk about, really three things I hope come across in this video. Okay, the first concept that I hope became clear, although we did not spend a lot of time in this video describing it, was the importance of the stability of the TM joints. We described Eric, he was having what we call manageably adapted TM joints. And the one thing again I want to emphasize again, although we did not go into great detail in the video describing this, was the importance of having stable or manageably adapted joints before doing any type of irreversible occlusal therapy. Secondly, and I think something we did hit very heavily on, is the importance of a proper determination of your physiologically seated condylar position. And I think, if nothing else came across in this video, was how that impacts upon the appropriate treatment. In other words, when we look at the two patients we've had, Eric compared to Debbie, different physiologically seated condylar positions, one went back, Eric came forward, and the dramatic impact that has upon the appropriate treatment. And then finally, I hope one other concept is just to emphasize the importance of what we call physiologic harmony or biomechanical harmony between all components of the mascatory system. This is something I can't emphasize enough. If we're going to predictably achieve our goals, that of heavy aesthetics, quality aesthetics, of good function, and maintainable comfort, then we have to maintain and achieve biomechanical harmony. Whether we're doing very conservative treatment as we did with you and with Debbie, which is really very conservative in the area of dentistry, or we're doing much more extensive dentistry, such if we were getting involved with porcelain veneers, or if you had gotten involved with full mouth orthodontics, or if you were involved with implants or more extensive dentistry. The importance of biomechanical harmony between all components of the mascatory system, and also between those components of the mascatory system to other structures in the head and neck, are so very, very critical. And I hope that comes across. And although this is really a video about implants and the importance of occlusion and implants, I think, and I hope it comes across how all these things really kind of blend and flow together. So in closing and in conclusion, I thank all of you for viewing this, who have sat through and watched all of this. And I really hope from the bottom of my heart that you've taken something from this. I hope you can apply some of the concepts, a little bit of the methodology to what you do in your daily practices. And ultimately, I hope, as with Eric here, I hope somehow that I help you improve the quality of lives of your patients. Thank you very much.